Did you know that 1 in 10 Malaysian women will suffer from breast cancer? It is the most common cancer affecting women in this country, and it accounts for nearly 28% of our total cancer cases. October marks Breast Cancer Awareness Month. The main focus for this event is to promote an understanding of breast cancer, especially early screening and detection of the condition. Several times we've seen that early detection is associated with better outcome. In addition to this, we want to offer support to all those brave women who are battling the disease and to celebrate those women who have actually won the battle against breast cancer. So what is breast cancer? Well, normally in our body, we have cells which are growing, multiplying, and forming new cells. When these get damaged or they aged, they are killed off. Sometimes this process goes very well. Instead of the damaged cells being killed off, they continue to multiply and grow, forming clumps of abnormal cells, and these are roughly referred to as tumors. Tumors can be of two types. They can be cancerous and they can be non-cancerous. When we get these cancerous cells inside the breast, it leads to breast cancer. So how do we detect breast cancer? Well, there are various methods that we can employ. The simplest is a self-screen, which can be done in the comforts of your home. Every month, roughly the same time, try to examine the breast and feel for any lumps, any change in the size, shape, appearance of the breast. Look at the skin. Is there any redness? Any change in the texture? Is there any dimpling? Look at the area around the nipple. Is there any flaking? Is there any crusting? Or is there any abnormal discharge? If any of these are present, it should prompt you to visit your local family doctor immediately. Once in the clinic, the main focus would be on history, followed by what is referred to as a clinical examination. During a clinical examination, similar to the self-examination, the doctor will examine the areas affected and look for any abnormalities. The risk factors for breast cancer are many, but most important among them include increasing age, obesity, consumption of large quantities of alcohol, using of hormone therapy, especially after menopause, and other factors such as an early age of onset of periods and a very late onset of menopause. Breast cancer does tend to run in families. So if you have your mothers, sisters, aunts who have suffered from this condition, it is imperative for you to have your annual checkups done. Some people carry a gene which make them more susceptible to get it. That's called the BRCA gene. All these are methods that we can employ to detect cancer early. Now, if a lump or an abnormality is noted, another common test which is done as an outpatient is an ultrasound scan of the breast. In women above 45, in addition to an ultrasound scan, sometimes a mammogram is performed. This is just an X-ray of the breast tissue which is taken on both sides. These simple techniques and methods can be employed by all of us to detect breast cancer early. And as you all know, early detection is always associated with a better outcome. I am Dr. Yasmin from the Ng and Singh Group of Clinics. Have a good day.